My name is Yang Han, and the skills video is for the insertion of a nasogastric tube. My patient today is Tran Nguyen, and he's a patient with a bowel obstruction and an exacerbation of Crohn's disease. The doctor has ordered the placement of a nasogastric tube for gastric decompression related to postoperative paralytic ileus. So I have already confirmed with the patient history that he does not have any contraindications to getting a nasogastric tube placed. So when I enter the room, I'm going to close the door to give him some privacy. Hi, my name is Yang Han. I'm going to be your nurse today. I'm here to insert a nasogastric tube in order to decompress your stomach, and that's going to just help you feel a bit of relief. Do you have any questions or concerns before we start? No? Okay, great. So before we get started, I am also going to identify the patient using two forms of identification. So would you mind telling me your name and date of birth? And then he would answer with his name, Tran Nguyen, and his date of birth. And I would check against his wristband to confirm that he is in fact saying that he is in fact who he says he is. So if the patient isn't already, I'm going to place him in high Fowler's before we get started, and then I'm going to make a couple assessments starting with lung sounds. And the reason I'm auscultating his lungs before the procedure is to get a baseline of what his lungs sound like, so that when I auscultate his lungs after the procedure, I can listen for changes that might indicate that the nasogastric tube has been placed in the lungs where it shouldn't be. I'm also going to examine his both nares and look for any indication of inflammation, obstruction, polyps, anything that can be an obstruction. And I will also verbally confirm with him that he does not have a history of nosebleeds or trauma or surgery to that area. I'm going to put on some gloves. And I'm going to assess for his gag reflex using this tongue blade. Alright, Mr. Nguyen, can you open your mouth and stick out your tongue? I'm going to use this tongue blade to gently touch the back of, gently touch your uvula at the back of your mouth, and that is to just test your gag reflex. Gag. Alright, so his gag reflex is in fact intact. And then I'm going to, so in real life, this would be a still unopened package that I am just opening now for the procedure. And I'm going to measure the nasogastric tube by measuring from the tip of his nose to his earlobe, and then his earlobe to his xiphoid process. And I'm going to just mark that with a bit of tape. Also going to just put a towel over his chest to protect him from any leaks or spills during this process. Alright, and then I'm also going to hand him his emesis basin and a cup of water So Mr. Nguyen, here's an emesis basin for you and a cup of water. So during this process, you're not going to be able to talk, so if you feel any discomfort or want me to stop, go ahead and just raise your index finger. Also, when I instruct you to do so, you're going to want to tuck your chin and then take sips of water from this cup, and then I will be moving the nasogastric tube forward with every time you swallow. Alright, so after setting up the communication and just getting him ready for the instructions of the, before we proceed, I'm going to coat the tip of the nasogastric tube in lubricant, and then I will begin to insert the nasogastric tube into the nares. Alright, Mr. Nguyen, here we go. Alright, and then go ahead and tuck your chin and start taking sips of water. So gulp, gulp, swallow, 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 swallow. Alright, and then just a note, in an actual procedure I probably would not be holding his head like this. This is just a very flimsy mannequin, but in the event that there was any resistance while I was inserting the nasogastric tube, or like if there was any resistance, or he started gagging or coughing, or his vitals started to change, I would stop, draw back on the tube, and then until that resolved, and before I continued. All right. And now that the nasogastric tube is into the point that was marked by the tape earlier, I'm going to take my pen light and just, can I get you to open your mouth, please? I'm going to look at the back of his throat and make sure that the nasogastric tube is in place, that it is nice and taut, and that is not kinked or curled up in the mouth. And then I'm going to take my piece of tape and anchor the nasogastric tube to the bridge of his nose. And then once I have that anchored, I am going to go through a few assessments just to confirm the placement of the tube. So first I am going to auscultate his lung sounds again to make sure that there haven't been any changes in his lung sounds that might indicate that the nasogastric tube has actually gone into his lungs. And before doing that, I probably should have taken these away first. So I'll just make a note that those shouldn't have been there. All right, and then, so the lungs sounded good, and it didn't indicate that there was anything abnormal or any changes. Next, I am going to inject some air into the nasogastric tube, and I'm going to listen to his stomach to see if I can hear the sound of air bubbles. Alright, so I was able to hear the air bubbles in there, and next I am going to also assess placement by aspirating some of the gastric contents, which I will put into a cup. And using a pH strip, I'm going to check what the pH of the gastric contents are, and I'm going to make sure that the pH is showing as 5 or below. Alright, and even after completing those 3 assessments, I'm going to want to use the gold standard of the facility and request that a chest x-ray be done to just confirm the placement of the gastric tube in the stomach and not the lungs, and that is especially true if anything is going to be going into the nasogastric tube and not just out. Alright, and now that I have confirmed the placement of the nasogastric tube, I'm going to mark the tube right under the nares. And I am also going to, I will remove the towel now. And I'm going to connect the nasogastric tube to his gown and make sure that there is plenty of slack so that it doesn't pull if he moves. Alright. And then I'm going to take the connector piece of the nasogastric tube and just stick it into the end of the nasogastric tube and then connect it to the room's suction. And then I'm going to remove my gloves for my hand hygiene. And then if the patient wishes it, I'm going to lower the head of the bed. However, I am going to make sure that I'm going to make sure that the head of the bed still stays above 30 degrees to decrease risk of aspiration. And then I'm just going to make sure that the patient is comfortable. All right, Mr. Nguyen, you're all set. Here's your call light. Let us know if you need anything. And then as I leave, I will close the door to provide privacy, and then I will document the procedure in the MAR. And actually, not yet. Before I leave, I would make sure to clean up and dispose of all the equipment and garbage in the proper receptacles. Alright, and then I would leave and give privacy. Alright, that concludes my video. Thank you for watching.